Hello there, welcome to my program. Monchero Kemwa here. Today we talk about carpal tunnel syndrome. What is carpal tunnel syndrome? What is a carpal tunnel? A carpal tunnel is a passageway for ligaments, tendons, and bones that lead to the hand, or that supply the thumb, the index finger, middle finger, and the ring finger. So any problem that affects the median nerve when it is coming from through the carpal tunnel is what we call carpal tunnel syndrome. What are the signs and symptoms of a carpal tunnel syndrome? One, there is pain, and this pain can be mild or severe. Mild pain can come in because of the compression of the median nerve as it moves from the forearm on its way to supply the thumb, the index finger, and the rest of the fingers except the small finger. Now, this pain also comes along with numbness. You can feel numbness in the palm of your hand, and also tingling sensations along those fingers that are supplied by the median nerve. Another thing you can feel in the symptoms, the fourth symptom is about weakness. You will have weakness to your hand, to the wrist, and to the fingers. Now, what are the causes? What are the causes of carpal tunnel syndrome? Number one, it happens because of repetitive activities to the wrist. For example, if you are doing the typing work, the repetitiveness of the typing work can cause inflammation, and the inflammation or the swelling and the compression of the median nerve as it passes through the carpal tunnel or the carpal passageway. Now, another thing that can cause the inflammation is diabetes. Diabetes also can cause inflammation of the joints, as well as another disease that can cause this is called arthritis. Arthritis also causes inflammation of the carpal tunnel that causes the pain that we talked about, the numbness, the tingling, and the weakness. Now, is there anything that can be done about the carpal tunnel syndrome? Yes, and these are the things, or these are the ways that we can manage carpal tunnel syndrome. Number one, it is resting the wrist. This wrist that has been used for some time, maybe you've strained it and you've been working so hard, it could only need something as simple as rest. By resting it, it will regenerate and then you will feel better. Number two, it is about splinting. Your doctor or your physician will advise splinting the hand in a neutral position. That splinting helps to immobilize the area, the carpal tunnel side, and reduce the inflammation. The third thing that can be done for the carpal tunnel is medicine. Sometimes you can even be given medicines which are called anti-inflammatories, which will reduce the swelling to your wrist. The fourth thing that can happen to in the management of the carpal tunnel syndrome is, in fact, stopping the activities that have been aggravating. Like if you are a tennis player, you can stop for some time until you feel better. Or if you are typing, you've been typing very fast, you can even delegate for someone else to do the work for you until you feel better. But if it gets worse, if the pain is not getting relieved by the pain medicine and all the other things that we have talked about, the rest, then we go in for a surgery. The surgery is called carpal tunnel release. And as I spoke about earlier, this can be done as a day care surgery case, where a procedure known as WALANT, wide awake local anesthesia no tourniquet, is used, and the surgeon cleans the area, numbs the place, and then does a nick to release the inflamed tissue and switches it back and then applies a dressing and probably a splint until you feel better. These are the simple ways of managing a carpal tunnel. A carpal tunnel may look like it's simple, but it is very complex because our hands are the ones that we use in activities of daily living. So if you are having these symptoms that I spoke of, that is pain, numbness, tingling, and the weakness of your hand, check with your orthopedic surgeon. There is a solution for you. If you are new here, be sure to subscribe, share, and comment in the comment section below. Thank you, and see you again in the next one.